But as anybody who's impacted by epilepsy knows, this disease comes with a range of risks. So we commonly hear from doctors to parents or patients about the risks related to driving or swimming, the possibility for head trauma. What we hear less about is the risk of mortality, and that's one sad reality that exists in our world of epilepsy. And those risks are less commonly discussed. So there's different ways that a person could potentially die from a seizure. One is drowning, another is an accident, head trauma. There's an elevated risk for suicide with people with epilepsy, status epilepticus. But another category of mortality within epilepsy is Sudep, sudden unexpected death in epilepsy. And that's actually the most common form of death in epilepsy. And it's just like it sounds. It's sudden and it's unexpected. That's how my nephew Danny died. And that's why our Danny Did Foundation was created, to try to raise the awareness and education around this particular risk so that other families weren't in the position of being totally blindsided by an outcome like my brother and his wife faced. So this is Danny on the left in the green shirt. He had 3 siblings, Mary Grace, his older brother John, and his younger brother Tommy. They're all, almost all of them are teenagers now. But Danny had his first seizure around the age of 2. It lasted about 10 minutes, and like a lot of parents, they went to the ER. They had a first experience in the ER, and they left there scared and without a lot of information on what to do next. And certainly they didn't have any direction on advocacy or support networks. So Danny, like a lot of families that we've come to know, started sleeping with his parents. His second seizure happened about a month later, and then he started taking medication. He had 2 more seizures in his sleep, and then a period of about 18 months where he didn't have any known seizures. His parents were doing bed checks, kind of taking different turns, looking after him at night. Fast forward to December 8th of 2009, he went to the neurologist, routine checkup. They said he was on a good track, increased his medication slightly for some weight gain, and said, keep doing what you're doing. And then 4 days later, on December 12th of that year, his mom found him in bed, and he had passed. So obviously a morning that we'll never forget. So the name of our foundation comes from the last line of Danny's obituary, which his dad wrote, and that read, please go and enjoy your life, Danny did. So despite the tragedy behind how we got started, we're trying to make something positive and have kind of a joyful, hopeful spirit about our cause. And that's kind of the root of what we're about. So we focus on 2 main areas. One, as I've mentioned, is the awareness and education around safety in epilepsy, and specifically the risk of Sudep. And then the second part of what we talk about are technologies and devices in the epilepsy space that can help to enable early intervention and help alert or predict seizure activity. So I'm going to play a short video that gives a little bit of additional background on what we're about.
For most families, bedtime is a peaceful...
My big brother, Danny Stanton, was full of life. He was full of heart. He was full of hugs. Danny was a special buddy who made us smile.
Danny was an affectionate and engaging, a social and athletic little boy. He was one of our 4 kids. And what I miss most about him is seeing him interact with his brothers and his sister. Not having him around every day is something that hurts constantly. But we've always said that his continued place in the world would be through the Danny Did Foundation.
Sudden unexpected death in epilepsy took Danny's life, but it didn't end his story. Started in 2010 by our parents, the Danny Did Foundation empowers my brother to continue impacting lives by spotlighting epilepsy, a disease that is misunderstood and severely underfunded. Epilepsy affects more than 65 million people worldwide and will impact 1 in 26 Americans. While the numbers are overwhelming, the Danny Did Foundation provides hope for those living with epilepsy. Epilepsy can be a daily challenge.
Really, to describe the challenges we face on a day-to-day basis, I think my wife Mary described it best with a child with severe epilepsy. It's really like having a newborn all the time. I mean, you're always watching that child. You're always aware of almost every movement that child has. And that can be very taxing for us on a day-to-day basis, just not knowing when the next seizure is coming.
Before Josie was born, I really had a fairly, I think, probably common misunderstanding about epilepsy, which is one that it's just, you just take a pill and it's okay. And in fact, I didn't understand the huge range of epilepsies, how insidious it is, how many people are affected by it, and most importantly, how many people can't gain seizure control.
Seizures are so unpredictable. You can think you're going about a normal day, and one will hit, and it disturbs everyone. You know, it ruins lots of days.
What frustrates me and my family the most about epilepsy is not being able to stop seizures. We can't stop them. They're relentless. She is not the person she could have been because of seizures.
Oh, epilepsy. We call it a thief. It comes in and strikes at any moment. Our biggest fear is Sudep. For most families, bedtime is a peaceful time. For our family, it's when the fear hits. We don't sleep. We're afraid we're gonna miss a seizure, and we will lose him.
So that is a constant fear. Again, it's this vigilance. And so she has to be watched. Imagine that. Imagine if you had to be watched every minute of the day. That's a huge loss for her, and it's a real challenge for us as a family.
A person is diagnosed with epilepsy after having 2 or more unprovoked seizures. Today, nearly 3.5 million Americans face the disease. That's more than any point in history. By engaging the public through youth programs, school presentations, and awareness campaigns, we educate society and reduce the stigma around epilepsy. Despite all available treatments, 30 to 40% of people with epilepsy continue to experience seizures.
Sudep is sudden, unexpected death in epilepsy. And one of the things we're most proud of at the Danny Did Foundation is raising the communication and awareness between the medical community and families who face epilepsy.
Our signature program provides seizure detection alarms for kids in need. These alarms enable early intervention when a seizure takes place. This makes an immediate impact that many families describe as life-saving.
Technology with epilepsy is key. The Danny Did Foundation offered an MFET monitor for Hank to sleep. It's a bed alarm. So when he convulses, the bed alarm goes off, and it definitely does work.
I'm really thankful to the Danny Did Foundation that we have peace in our house and a way to know what is happening with my child when I can't be with him every second.
Fueled by fundraising efforts like Team Danny Did, Danny's Foundation makes a positive, lasting impact on families by giving them a sense of strength, safety, and community.
Danny Did is pushing that envelope, always from the point of view of families who have been affected by this. They're informed by that. So what it means is that we have a voice at the table.
It's just really helpful for us to realize, hey, we're not the only ones out there dealing with a situation like this.
How do you make misfortune have an explanation or a purpose? And for us, working with groups like Danny Did and working with the Stanton family, it just allows us to make meaning out of something that otherwise is just a bad deal. We don't have a lot that's within our control, but we can control that. We can contribute in ways that are meaningful to people and may really change a kid's life, which is pretty awesome.
I received a phone call, and the first question is, they said, "How is Hank?" tell me about Hank. And it was then that I knew somebody cared. And those few words made a difference.
Danny was always enjoying life, every day. Your friendship and support helps families who face epilepsy to enjoy their life too. Through our foundation, we keep writing my big brother story, helping to make this a better world.
So that's a little bit of background about who we are and what we do. And next I'm going to just give kind of an overview of Sudep, what it is, how often it happens, what are some of the risk factors. So a death is referred to as a Sudep when a seemingly healthy person with epilepsy dies unexpectedly and no clear reason for death can be determined. So in most cases, an autopsy takes place, and there's some criteria that determine whether it's a case of Sudep. The person has epilepsy. The person died unexpectedly while in a reasonable state of health. The death occurred suddenly and during normal activity. So in Danny's case, it was during sleep. An obvious medical cause of death could not be determined at epilepsy, and the death was not a direct result of status epilepticus. So cases of status are not included as a Sudep case. So in most cases with Sudep, the death is not witnessed. The patient is usually found in bed in the morning. That was the case with Danny. And really what causes Sudep is still unknown. It's still being studied. So we don't know exactly what causes it, and that adds to the frustration. But there are a few main theories. So a cerebral shutdown, essentially the brain shuts off after a seizure and breathing is suppressed. So a lack of respiration may be a primary cause. Cardiac abnormalities. So seizure could cause a dangerous heart rhythm or even heart failure. But I think the most likely scenario is a combination of those and the fact that it may be a little bit different in each person who suffers a case of Sudep. As far as how often it takes place, the most recent research indicates that about 1 in 1,000 people with epilepsy will die from Sudep, and that applies to both adults and children. And then when you get into the population of uncontrolled epilepsy, the number changes to about 1 in 150. So seizure control is really the most important factor. We talk about risk factors for Sudep. As I mentioned, uncontrolled seizures and regular tonic-clonic seizures at night are two of the biggest risk factors for Sudep. So if people have either of those or both, they're in a high-risk category. And for Danny, he had convulsive seizures during sleep, so he fell into that category. Other risk factors to think about, epilepsy beginning at an early age, having epilepsy over a long duration of time, not taking medications regularly or as prescribed, stopping or changing medications suddenly, and drinking alcohol are all risk factors to be aware of. So a key message that we always put out is that it's really important for caregivers or adult patients to talk directly with their doctors to learn their individual risk level, to kind of tailor it to your child or your loved one. And surveys say that about 95% of parents want to hear or want to be informed about this risk, but certainly disclosure does not happen anywhere near that rate. So there's a disconnect. So we're always putting out the message that, the conversation about the risk of Sudep is best delivered by a medical professional. But in Danny's case, his parents didn't hear about the risk of Sudep until it was on his death certificate. So we're here to help fill that gap and to talk with parents about this particular risk, but we always advocate that doctors talk about it on their end. And when talking about this risk, we really want to emphasize the actions that people can take to minimize the risk. And so we want to empower parents and empower patients to feel like there's something they can do. And I'll just quickly go over some of those steps. We want people to advocate for increased awareness. So we had never heard about Sudep, and we've talked to a lot of families who have lost loved ones who hadn't heard about Sudep either. So we work hard to kind of get the word out. This is a billboard that we have at O'Hare Airport. We've done different public awareness campaigns and just trying to get the idea of here's what epilepsy is, here are some of the risks related to it into the mainstream public. Maximizing seizure control via strict treatment adherence, whether that's medication or something else, is really important to minimize the risk. Regular physical activity and lifestyle habits that reduce stress and seizure activity is very important. Regular doctor visits, especially for people who are uncontrolled. Ensuring that the people in your loved one's life are knowledgeable about resuscitation measures, including CPR, is important. And then just advocating for research to help us understand the causes of Sudep is a big thing too. And then the last one is something that we focus on a lot at Danny Did, and that's looking into alternative resources such as monitoring devices that can detect certain seizures and alert caretakers to enable intervention. So that's where we do a lot of our work and spend a lot of our time. We're big believers in the concept of early intervention. You know, that simple premise that if mom or dad or a husband or a spouse is in the room to take action, the person who's seizing is going to be in a much better position to have a better outcome. So we know it's not easy to stay current on all of the technology options. There's a lot of things out there. It can be kind of overwhelming to navigate. And that's where we kind of try to help families think through what are their options. So we've come up with this checklist of things to think about, and they're all pretty common sense, but I'll run through them here. The first one is maybe the most obvious, making sure that the system aligns in terms of detection with the seizure type that your loved one has. So what is it that indicates their seizure activity? Is it movement? Is it oxygen levels? And making sure that matches with what the system is designed to do. Determining your goals for the device. Do you want it to track seizures? Do you want it to alert you? Those are things to think about and make sure that you're going to accomplish your goals with a certain system. Considering the comfort and of the device. So does your child want to wear a watch? Does it irritate their skin? Are there age restrictions, weight restrictions? Is your child going to be comfortable being monitored if there's a camera involved? Determining how easy is it to use. You know, are you really comfortable with the technology involved? Are there other accessories that are required to make it work properly? And how does that fit with your lifestyle and your comfort level? And then lastly, how much does it cost? You know, is it a one-time cost? Are there monthly subscriptions to know about? Can you sustain those over time? Is there the possibility for insurance coverage? So we have that brochure checklist at our table if anybody wants to use it. And then one thing I want to mention, and then I'll turn it over to Luke. Our signature program is to provide grants to families who find a monitoring and alerting system that can be a fit for them, but the finances are a challenge. So if you're interested to hear more about that, stop by our table. And remember, you know, you want to solicit advice from other parents, from your neurologist, from your own research, but ultimately you're going to have a sense for what fits for you, and really trust your instincts after you do your research and make that decision for what's best for your family. So next I want to introduce Luke Whitmire, who's the Chief Science Officer at Brain Sentinel, and he's going to tell you about their product and answer any questions. Thanks.